Sharing live stream. Hello, good afternoon, YouTube. Good afternoon, everyone, depending on where you watch this video, because you might get the link on your Zoom, on your WhatsApp, wherever you come across this video. Hello, my name is Ewino Sarabo Esangbedo, and thank you so much for joining. Thank you so much for being a part of this event. As you know, we are Divinely Classic. Divinely Classic is an entrepreneurship brand, and we also do health education. We encourage healthy living. We are on Instagram. We are on YouTube, like you're watching us from, and we are on Facebook. We're also on TikTok. And as you know, today's event is a health education event, which sadly we haven't done in a long time, going to 2 years now. Like I said in the previous video, we haven't done a health education event, but I had to do this one because I was, just browsing the internet, and I saw a sister of mine who is also a doctor, and she was talking about glaucoma, trying to raise awareness for glaucoma. And I thought, do you know what? I haven't done any eye events. And I got in contact with her to say, oh, do you want to come on my platform just to talk about glaucoma? Because there are things that we come across every day that we don't really know the meaning. One is glaucoma. There are loads of different eye conditions that we don't really know the meaning. So I thought that's a good idea. Let me invite my sister, who is also a doctor, an ophthalmologist, to discuss glaucoma with us. So that's how this event has come about. So thank you so much for joining. Thank you so much for watching. At the moment, we're still trying to get her to join in. So I'm so sorry. I have to apologize for that. Still, she's tried to log in, and for whatever reason, I think it's the internet, it's taking her out, and then we're struggling with the audio, the video, and all that. She's trying to sort that out in the background. As soon as that is done, she will be with us. So yeah, but stay tuned. Stay tuned. I am not an optician or an ophthalmologist, but I am a registered nurse, and we do have very minimal, knowledge about some basic conditions. One thing, at least I know that I can tell you, is that glaucoma is an eye condition. And before she comes in, because she's well prepped, she's got PowerPoint and all that she will be sharing. But again, I apologize, we're just struggling with the internet, so she's trying to log in, but the internet is not letting her log in at the moment. But before she comes, I had to do my own research, because for every topic that I have to do educate people on, I also like to educate myself first, because you can't give what you do not have. So I had to do a bit of research just to see what glaucoma is. And from one thing we can say, glaucoma is a group of eye conditions, so not medications, I beg your pardon. Glaucoma is a group of eye conditions that damage the optic nerve in the eyes, obviously. And over time, if this condition, this eye medical condition, is not treated, it can lead to vision loss or total blindness for people. So that's why it's important, when you hear events like this, it's important that you try to educate yourself. That thing might not be it might not be a condition that you suffer at the moment, but we don't know. If you know about it, ways to prevent it, then you don't even have to have that condition. And one key thing about glaucoma is it is often caused by increased pressure in the eyes. And we know that all our bodies are wired together. We've got nerve, we've got blood cells, we've got blood vessels. That's the word I was using, looking for. We've got blood vessels going through every part of our body, and we also have the ones going to our eyes. And the eyes are very delicate. And I don't know if for people that do regular eye check all the time, as you can see, I have got my glasses on, so I do have eye check all the time. And because of this event, I had to go do my check, which I was due for anyway. I had to go do my check last week. And sometimes they'll put your eyes in like a big machine, and they'll push like a air, like push in your eyes. I think that's just to check the pressure in your eyes. So glaucoma is often caused by increased pressure. I would also liken it to um a blood pressure. If you know how blood pressure works by that increased force or push of blood against the vessels. That is how it works. So we liken it to the eyes now. So there's increased pressure in the eyes. I think I've got my guests online. Let me see. Trying to join in again. Like I said, the internet is not our friend. Hopefully to be a friend. She's trying to join in now. Hello, Dr. Inye. Can you hear me? If you can, please unmute your mic. You're muted. Yes. Hello. We got there in the air. I can see you. Thank you, Lord. After all the issues, at least we got here. So thank you so much for joining. I was just trying to do the very basic because I'm not an eye doctor. I am just the regular nurse. So I was just trying to talk just to keep people on while we wait for you. But thank you so much for joining. After a brief introduction, I'll just do it again for the sake of those that are just joining. So again, my name is Ewenu Sarabo Esangbedo. I am the face behind Divinely Classic. And as you know, Divinely Classic is an entrepreneurship brand. By profession, I'm a registered nurse. I'm also somebody who's very passionate about health education. That's why we're here today. I did mention earlier that I was just scrolling through Facebook and I seen a post by my sister, Dr. Inye Boy, and she was talking about glaucoma. And I thought, glaucoma, that's interesting. That's not an area of knowledge. I don't know anything about eye health. So I contacted her and I thought, okay, let's do something together. And here we are. So thank you so much, Dr. Inye, for joining. If you can just introduce yourself, please. Thank you.
All right. Good afternoon, everybody. I'm Dr. Inyenusa Owagboy. I'm an optometrist in Nigeria. And it's good to be here. It's good to be with you today to talk about your eye health. And I'm so happy for having a platform like this. Thank you so much.
Thank you, Doctor. God bless you. I'm just going to download the PowerPoint that you sent. So I've just downloaded it. And if you can just give me a minute, let me share the link again for people that haven't joined. We do have some people watching already. Thank you so much to those who are here. Please share the video. Please share so that others can join in this topic. If you can share from your end as well, Inye, so that people can join. There's an interest. I love health education. I love health education. I like to just research on a topic and share with others, because what's the point of having knowledge when you cannot share? So yeah, let's get more people in. Okay, so I've just shared now. So I'm going to share my screen. Hopefully everybody can see. So I'm going to share my screen. And when I share my screen, you can just crack on. Okay. Let me try and share. Okay, I think we should use this one. I'll share my one. Okay, open. And when I share my screen, you can just crack on. Okay. I'm just sharing them. Okay, I think we should use. Let me stop sharing. Stop share. I'm stopping sharing now. I'm going back to open it on PowerPoint. So just
Okay.
bear with me, bear with me. I've only just got this this file. Let me stop sharing. Stop sharing. I'm stopping sharing now. I'm going back to open it on PowerPoint. The echoing, I don't know where it's coming from. Is it from my end or yours?
I think it's from your end.
How is that happening?
Mhm.
Now I'm going back, open it on PowerPoint. The echoing, I don't know where it's coming from. Is it from my end or yours?
I think it's from your end.
I'm not sure where how to get that. Okay. Anyway, we'll carry on. The echoing, I don't know where it's coming from. Is it from my end or yours?
I think it's from your end.
I'm not sure where how to get keeps that. Repeating. Okay. Anyway, we'll carry on. Can you share? Can you manage to share your screen in here?
I'm actually using my phone now. I can't use my system. If you notice,
Okay.
I can't use my computer, my laptop now. So that's why I'm using my phone.
Okay.
I'm actually using my phone now.
I'm not sure why it's echoing. I don't know where that's come from.
Do we need to start all over? Do we need to leave and get back?
Okay, can you try and go back and come back in? Because I'm not sure it's from my end. Yeah.
Okay.
Hopefully you can come back while I try to share. My phone now. I'm not sure why it's echoing. I don't know where that's come from. So it's definitely my end.
Do we need to start all over?
Because Inyo is not here. Apologies to our viewers. We're just trying to sort the audio out. Yeah. Hopefully you can come back while I try to share. Oh, I got it. Sorry, everyone. It's gonna be a great day. So it's actually from my end. I apologize for that. Okay, trying to get the PowerPoint up. Okay, I might have to join from my phone. Again, sincere apologies for the delay. It was down to internet. The internet really wasn't our friend. Hopefully it will be like I said earlier.
Okay, I don't think there's any echo anymore.
Yeah, it was from my end. It was definitely from my end. So there was a window that I opened that I shouldn't have opened.
Okay.
So I'm going to join with my phone. Can you hear me?
Yes, I can hear you.
This one is echoing because it's my phone.
Okay, because you're using your phone. Are you using your phone and your computer together?
Yeah, because I was going to use my phone to share because I can't seem to share it on my computer. So I wanted to use my phone to share it.
Yes. Okay.
Okay. Let me open and see if I can. It's not going at all. I don't know what's wrong with this one. Yeah, it says it's experiencing error. I can't open it.
Can you hear me?
I can hear you.
Okay, I just wanted to be sure.
Yeah.
I'm not
Even though we
exponentially.
can't see, to save time, because even though we can't see, we can't see the screen, but can you just start talking about what you
All
have?
right.
Do you have the information with you?
Yes, I do. I do.
Yeah. Okay. So can you just start telling us about glaucoma, and I'll try to set the screen up. I will be on mute. Yeah.
Okay. Now the way I place the screen is not just glaucoma. I'm going to talk about like eye health in general. All right. Then I'll talk more on glaucoma. Is that okay? Network. Hello? Can you hear me?
I hear you. I can hear you. I had to put myself on mute so I can hear you. You carry on. You
All
take
right.
over. It's your show now. Take
So
over.
it's my pleasure to speak to you today. And today we're talking about caring for your eyes, common eye problems. Yes, I'll be talking about glaucoma and other eye challenges or problems and how you can actually prevent them. All right. How often do you think about your eye health? All right. According to World Health Organization, at least 2.2 billion people worldwide have vision impairments, and almost half of these cases could have been prevented. Now, vision loss can affect people of all ages. Most people are from the age of 50 years and above, and an eye examination can actually detect early signs of diabetes. Okay, you're sharing, oh, perfect, perfect, perfect. I can't hear you anymore. All right. So I'm in the second slide. Okay. Can you put it there? Now, most people only visit the eye doctor when they have problem, but they do not know that a regular eye check can catch diseases early. We rely on our eyes every day, and yet we take them for granted. So ignoring eye health issues can lead to serious conditions like glaucoma or vision loss. Now, the good news is many eye problems are preventable. Many eye problems are preventable. So today you will learn about how to care for your eyes, common eye problems, symptoms, and prevention tips to maintain good vision. Okay. So the third slide, when was your last eye checkup? I was hoping to have a fuller house, but we're going to do this test. We're going to do this eye test. So what we're going to do is that you're going to focus on the word on the slide. On the slide, just focus on the word. Just pick a particular word, focus on it. Then you close one eye. Have you done that?
Yes.
Okay. The next, then switch to the other eye, close the other eyes. Do you notice any difference in clarity between the two eyes?
Yes, I do.
Okay. So if yes, it might be time for you to go for an eye checkup. Yes,
Yes.
of course. So now let's take a look. Let's take a bit. Let's discuss how to take better care of your eyes. Now, the first thing we're going to do is to observe the structure of the eyes. The next slide, please. The next slide. Okay, fine. Now this is the eye. Now the top portion is what you will see. Any person you're looking at the person side, this is what you will see. The external surface of the eye. Now we have the iris, which is the colored part of the eye. We have the pupil. It's actually transparent, but when you're looking at it in the media, it looks as if it's black. Then we also have the sclera, which is the white portion of the eye. Now, if this eye, if you look at it from the side, you're going to see the mossus, which is responsible for its movement up, down, left, right. That's what the mossus is for. We have the conjunctiva. is like a cellophane kind of covering on the white part of the eye. We also have the cornea, which is the black part. It's actually transparent depending on the color of your iris. All right. Like for me, I have a brown iris to look as though dark brown. So it may look like I have a black eye. All right. A black cornea rather. But it's actually dark brown. Then we'll have the lens of the eye, which you don't see from the outside, and the vitreous, which keep the eye in shape. The optic nerve is the connection between the eye and the brain. And I want to tell you something today, that the eye is an extension of the brain. The eye is an extension of the brain. Okay, please let's go to the next slide. The eye is a sensory organ that enables vision by capturing light and converting it into signals that the brain interprets as images. Now, I want to use this. Oh, okay. Can you see this? Can you see what I'm holding?
Yes.
Okay. I don't know. I'm not seeing myself. I'm just seeing you. Okay. Now, this is the eye. This is how everybody's eyes look like. You see not because your eyes are open. You see because light from an object is able to enter through this pupil. All right? Enter here, and the inside is transparent. Can you see it? The inside is a transparent medium. It's a transparent medium, all right? That's what I was showing you on the previous slide. Now, it's a transparent medium. So the eye needs a transparent medium. It needs a transparent medium for light to pass through, and it's being sent via this optic nerve to the brain. Now you see some person, their eyes look very normal on the outside, but they are not seeing. So there must be something within this portion that is faulty, either in this media, or from here. So when light enters here, it's being transferred through this optic nerve to the brain, and the brain does the interpretation, right? So the eye needs the brain for it to interpret what you are seeing, and it happens in less than a second. Okay, so the primary function of the eye is to perceive visual information, allowing us to see the world around us. And the eye is a complex optical system that allows light, regulates its intensity, and focuses it to form an image and convert the image into electrical signals that are transmitted to the brain via the optic nerve. Okay? So let's go for the importance of eye care. 80% of what we learn is visual. We are here today. If you don't have eyes, if your eyes are not working well, obviously you will not be enjoying what we are doing. Seeing this beautiful girl on this slide, you will not be able to appreciate it. It also improves productivity. Without your eyes, you know you can't be productive. Not productive, yes, I know to some extent, even the visually impaired, they try to do some certain things, but not like when you are with your two eyes working. While your eye care matters, it also helps to prevent vision loss and detect systemic health issues. There are a lot of systemic health issues you can actually get from the eyes. So when you go for an eye check, you don't just want to give you glasses. You want to check if you're well, not just your eyes alone. You want to check your all-round. Are you hypertensive? From the eyes, we can know if you're hypertensive. We can know if you're diabetic. We can know if there is even a tumor, we can tell from the eyes. Yes, a brain tumor, we can tell from the eyes. It enhances safety, and it protects you against eye disease when you take care of your eyes, and promotes your overall health. So now, this is the next slide. Okay. we'll be looking at the common eye problems. We have myopia, hyperopia, presbyopia, cataract, glaucoma, dry eye, age-related macular degeneration, diabetic retinopathy, hypertensive retinopathy. So I'll be taking them one after the other, all right? So the next slide, please. Okay, myopia. Okay, myopia, also known as short-sightedness or nearsightedness, is a common vision condition where close objects are seen clearly, but distant objects appears blurry. It affects millions of people worldwide, especially amongst children and young adults. According to World Health Organization, 30% of the world is currently myopic, and by 2050, almost 50% will be myopic due to lifestyle. If you know now, a lot of things have actually changed. If you know, I remember how we grew up is a different thing now for the kids now. Then we learned to play outside. We don't do our plays inside, or we start watching one game. We're not even into TVs, computers, and all the rest. The lifestyle now is a different one for children. They are into one game, one tablet, phones, everything near. There is not much of outdoor activities as such. So we'll be talking about the causes of myopia and how it relates to our lifestyles. Okay, so causes are genetics. It runs in families. Now you see that excessive screen time and near work, reading on computers, using computers, playing games, and all the rest with gadgets. Then lack of outdoor activities. Now, the symptoms that may present will be blurry vision at distance, squinting to see things at far, you understand, headaches, eye strain. You see that such child will want to sit in front in the class because cannot see the board from the back. So how do we prevent it? Now we'll follow the 2020 rule. Now the 2020 rule says that for every 20 minutes you're on your system or you're using any gadgets, for every 20 minutes, you give it a 20 seconds break and look at something 20 feet up, far away, like 20 feet away for 20 seconds. All right? You give it you're just training your eyes. Because when you look too much to the computer, you tend to give yourself so much fatigue on the eyes. Especially for children. Once they are on that system, once they are on that game or say tablet, they tend not to do all that. They are so focused on it. All right. Increase outdoor activities, games. Yes, going out for games, engaging them in outdoor activities, different games that can actually make them go outside, not just being indoors. Limit screen time and maintain proper lighting. You see that these days, even children, even late at night, even when you turn off all the light, they are still with their gadgets, still pressing. All these tend to affect and cause myopia. So the correction for myopia is glasses, contact lenses, or refractive surgeries. So let's go to the next slide. Now, this is what, okay, this is a picture of someone that is myopic. If you look at the background, you see that everything is blurry. But with the glasses, it becomes very clear. So the next slide, please. Hyperopia. Hyperopia is a condition where distant objects are seen clearly, but close-up object appears blurry. Now you see that it's a reverse of the previous one we just talked about. They have difficulty focusing their eyes on things up close. This is common in both children and adults, but more in adults. Causes also genetics, the flat cornea, you know, I talk about the cornea, these black parts, or having a short eyeball. All those you will barely even know. This is the practitioner that will be able to tell about that. The symptoms includes blurry vision while doing near work, headaches, eye strain, double vision while reading, squinting so hard when reading, or difficulty reading. So prevention could be lifestyle habits, by eating nutritious diet, because for hyperopia, we've actually not been able to pinpoint a particular thing that can actually prevent it, like scientifically proven. But we'll just give our own tips to help you with your eyes. You eat nutritious food that has nutritious diet with vitamin A, C, E, lutein, zeaxanthin, all right, and get regular eye exams. Now, correction will also be glasses, contact lens, and refractive surgery. So we're going to, okay, this is how it looks like. The next slide, please. This is how it looks like for a far-sighted person. The vision is blurry. Anything close is blurry. They have difficulty reading. They struggle so hard to read. They have dull pain in their eye, and they're always straining. There's headaches and squinty while reading. Okay. So the next slide, we'll go to the next slide, please, is age-related condition called presbyopia. Now, the difference between presbyopia and hyperopia is that presbyopia is age-related, and this is as a result of loss of flexibility in the lens of the eye. Okay, the lens of the eye. This is the lens of the eye. As you grow older, it loses its flexibility. It will not be as flexible as it used to be when you were much younger. All right. From the age of 40, you'll find that when you are reading, some persons experience it in their late 30s, that when you are reading, you have to take your book a bit far from your eyes before you're able to see. Some persons will like, if I take it like this, I will see it too. But when I bring it here, everything is blurry. Yes, that's what we call presbyopia. It's an aging process. The lens loses flexibility because the lens is such that as you grow older, lens cells, they keep adding to it. They keep adding to it. So it becomes more rigid than when you were much younger. So when you were much younger, you could actually focus at near and at far without any difficulty. But with aging, it becomes a bit tough. So causes are aging, lens stiffness, and reduced ciliary muscle strength. Symptoms are difficulty reading in dim illumination. Now you see such persons when they are reading in a place like this, they carry an extra torchlight. They carry an extra torchlight and they want to see in a well-lit place. And you're like, I cannot see this word very well. They find it very hard to see those things. Then blurry vision at near, eye strain, headaches, holding reading material far away from the eyes. Now, correction is give reading glasses. Reading glasses, those are the ones you just get from the supermarkets. You just go pick up and take it and use it to see what you can. Or you go to your doctor, your eye doctor, and you'll be issued bifocal. Those that have both like a two-powered lens, one up and one down. The one for distance and one for near. The near for reading. Or progressive lenses. Progressive lenses do not have any demarcation. There's no demarcation at all. It's just something like what I'm wearing. There's no demarcation, but it's a 3-in-1 because you can use it for your distance, your intermediate. That's the intermediate is the distance between you and your laptop or your computer, or near. Okay. Or you go for contact lenses. There are some contact lenses that are for presbyopia, or you go for your LASIK, which is a refractive surgery, where one eye is corrected for near and the other for far. Now, see this man. Next slide, please. This man, he's stretching his hand so long. This is what presbyopia makes people do when you're not with your glasses. They are trying to read. When they take it far, it tends to be clearer. But when it's near, it's not, it's not clear. All right. Okay, so let's go to the next slide. Now we're going to cataract. Cataract is the clouding of the lens of the eye that affects vision. Usually, this is caused by aging, but some other factors can actually cause cataract on the eye. Now, you're seeing this lens is transparent, but when there's cataract on it, it is no longer transparent. It becomes like whitish. It becomes whitish. So imagine when light is trying to go in, the light gets back scattered. It gets scattered because it's not transparent. So light cannot go in. So aging can cause cataract, injury, systemic conditions like diabetes can cause cataract, use of some medications like corticosteroids. If you use it for a long time without any supervision, can cause cataract. Trauma to the eye, that's an injury. Maybe somebody punches the eye, it can cause cataract. Okay, and exposure to too much UV lights can also cause cataract. So symptoms are blurry vision, double vision, light scattering, and sensitivity to light and glare. Sometimes some persons will complain of fading or yellowing of lights, seeing halos around light, as you're seeing some colors around light. When they look at a white light, they'll see colors around it. Risk factors are aging, diabetes, exposure to UV light, smoking, yes, smoking because it causes free radicals to get into the body. Obesity can also cause it. All right, so we're going to think about the prevention of cataracts. Regular eye exam. For those that are smoking, they'll have to stop smoking. The use of sunglasses to protect against UV lights and reduction of alcohol usage. Now, the treatment for cataract is just surgery. At an early stage, we could actually give some eye drops to limit its progression. But when it gets to a mature state, the only option we have is to take off the lens, take it off, and another lens to be replaced with an artificial intraocular lens. So next slide, please. Next slide, okay. Now this is the eye. If you notice this person's eye, yes, the whitish part, that is cataract. If you notice the other eye is clear, the other eye is clear, but this one is whitish because of cataracts. So can we go to the next slide? Now we have gotten to glaucoma. We've gotten to glaucoma. Glaucoma is a group of eye disorders. Now, 2 weeks ago, we had a World Glaucoma Week. We had to go out to sensitize people about glaucoma. Now, glaucoma is a group of eye disorders that damages the optic nerve. I'm still coming back to this. The optic nerve, leading to a reduced visual field and subsequent vision loss, is a leading cause of irreversible blindness. And that is why we call it the silent thief of sight. Now, who is a thief? A thief is somebody that comes and takes you unaware and just steals something from you. All right, take something that belongs to you and just without you being aware. So we call glaucoma a silent thief of sight because at the early stage, there are no symptoms. At the early stage, there are no symptoms. So it comes and gradually steals your vision without you just knowing. And the time, most times people know is at an advanced stage. Now, the risk factors for glaucoma are myopia, and that is why we always keep hammering on myopia. Myopia is a condition that causes a whole lot of issues when it progresses. So that's why we try to correct myopia, or we call this that there are some special therapies we use for myopia control to prevent it from progressing. Myopia causes contact glaucoma, ocular hypertension. That means just as you have high blood pressure, hypertension, we also have ocular hypertension, whereby the intraocular pressure of the eye becomes high. And when the intraocular pressure of the eye becomes high, it starts damaging the optic nerve. Genetics, glaucoma runs in families. So if anybody in your family has glaucoma, you don't need to wait. You need to go and have your eyes tested. Just go check. Some certain medications, also steroids, corticosteroids, too much usage can cause glaucoma. Some medical conditions also can cause glaucoma. Hypertension, diabetes, this thyroid disease, they are all conditions that can cause glaucoma. Trauma to the eye can cause glaucoma. Then there are some certain races that are predisposed. Africans, Asians, Hispanics, they are predisposed to glaucoma. So we're looking at the types. There are different types of glaucoma, and the types I listed there, there's the one we call the open angle glaucoma, the acute angle closure glaucoma, the normal tension glaucoma, the congenital glaucoma, and pigmentary glaucoma. Now, for the open angle glaucoma, I'm going to say something, I'm going to expatiate on glaucoma. Let me go back to this, my eye model. Okay. I open this so you see how the inside of the eyes looks like. Okay. Now, there's a fluid in the front of the eye, in front of this iris. We call the fluid aqueous humor. The other one is here, vitreous humor. All right. I don't know if you remember your biology. I remember they taught that then, but we really didn't know what it was. So in the open angle glaucoma, this fluid is in constant production. So, and there's also a drainage part for it to be drained off. So when this fluid is in too much production, and is not being drained out effectively, it starts causing a damage at the optic nerve. That is when we now say the pressure of the eye is high. By the time it's being tested with a tonometer, you'll say the pressure is high. That's what we call ocular hypertension. Now, for open angle, the angles, the drainage angles, they are actually open, but the production of the aqueous is so much that it's not even draining as it ought to drain out, as fast as it should drain out. So that is a type of glaucoma, open angle glaucoma. Then we have the acute angle glaucoma, acute angle closure glaucoma. Now, for this acute angle closure glaucoma, the iris, this part, the colored part, it pushes out and covers the angles, the drainage angle, the drainage channels for the fluid to pass out. And usually comes with, it's an ocular emergency when it comes to the clinic. It's an ocular emergency. It's either you quickly crash down the pressure with drugs, or we just even take the person for a laser surgery. Right? It's an ocular emergency. The person comes with severe pain, headache, redness of the eye. The person is not comfortable. And within a short while, within a split second, if you miss that diagnosis, or if the person doesn't get to the clinic on time, that person may lose that vision. That's within a short while. That's for acute angle glaucoma. Then we have the normal tension glaucoma. that one, the pressures are actually normal, but blood flow to the retina is minimal. Okay, and that is why I'm telling you, I'm just giving you the types. I'm telling you there are different types and trying to explain so you know that there are different treatment regime for each of these types. They are different. For congenital glaucoma, the child is actually born with glaucoma, born with it. All right. Then pigmentary glaucoma, some pigments actually from the eye, from the lens, it falls out, and from the iris, it falls out and cover the channels for drainage. So this to prevent drainage and causes an increase in pressure. Now the symptoms, can we go to the next slide, please? The symptoms, okay, very good. The symptoms depend on the type and the stage of the condition. So they can be blind spots, blurred vision, eye pain, halos around light, vision loss, bad headache, redness, blood vision with exercise. So it depends on the type, which I just talked about, and the stage of the condition. If it's at an early stage, you may not really experience much of symptoms, but usually at an advanced stage. Now, prevention is get regular eye examination, know your family's eye health history, wear eye protection. Now, for some persons that work in companies, you know, there are some organizations that they have their safety goggles, maybe because as a result of what they're exposed to, maybe there are some flying objects that could actually get to the eyes. Please put it on. If you are given an eye protection, so here in Nigeria, they could be very stubborn, and sometimes you see them saying, I didn't feel like wearing glasses. No, you should. When they tell you to, if you are given a safety protection, you should use it for your own eyes. All right. I remember some time back when a patient came into the clinic and he was he complained of his eyes, that something fell into his eyes while he was welding. Imagine somebody welding without a safety goggle on the eye. And he was actually begging me not to let his company know that he wasn't wearing his safety glasses. And by the time I checked his eye, I could actually see there was a foreign body that was embedded on the cornea of the eyes. So until I took it off, he was not himself. So please, let's be careful about putting on eye protection. If you are given one, please use it. So take prescribed eye drops regularly. If you are given, you will be given an eye drop to use, or whatever eye drop you are given to use for your eyes, please use it. Now, tips to help control eye pressure: eat healthy diets, exercise safely, limit your caffeine, sip fluids carefully, and take your prescribed medications. Okay, that's helped to control your eye pressure. Now, treatment for glaucoma includes use of medications, laser procedures. Now, we plan this such that we start with medications, all right? We will either be giving you eye drops or tablets to bring down the pressure. And when we are giving you that, we'll tell you, we'll book an appointment that you should come. We schedule an appointment that you should come at a particular time. So when you go at that particular time, you'll be, your eye pressure will be tested. If it's falling within line, we'll continue with the drugs. But if it is not falling within the range, the normal range that we want it to be, we would have to change the drug. All right. So that's why you need to always go until you get something that actually works, and a medication that works well for you. Okay. Now, If that medication is not working well, we've tried others and they're not working well. Maybe we've added combination drugs and they're not working well. We'll go for a laser procedure. Now, what a laser procedure does is either to create some openings at the iris, which is called the iridate of the iris, okay, which is called the iridotomy, or the trabeculotomy, which creates channels or holes in the trabecular meshwork. That is the real drainage angle for the aqueous. So we do that. So that is being done. When that is done, if the pressure is still not coming down as we expect it to be, then an open surgery will be done for the person. Then, like a permanent drainage will be opened for the aqueous to flow out. Okay, so notice that the treatment does not cure glaucoma, but reduces the pressure on the eyes. Glaucoma does not have a cure, and that is why we're always telling people, go have your eyes checked. There is no cure for glaucoma. The only thing we can do is to manage the pressures, manage the symptoms. It does not get worse than it is. Okay, so let's go to the next. Okay, this is how the eye looks like, healthy eye. Next slide, please. Okay, the healthy eye. The one on the left has the normal pressure. So you could see the veins, the veins, the arteries and the veins. You can see them, but compare it with the other one on the left, the right-hand side. There's already damage. You can see that it's even getting shorter. The arteries and the veins are getting shorter. They are dying off as a result of buildup of pressure in the eye. All right. So let's go to the next slide, please. So the next is dry eye syndrome. Dry eye syndrome. It's also known as dry eye disease. It occurs when the eyes do not produce enough tears, or the tears are of poor quality and evaporate quickly. Now, there are different causes: aging, hormonal changes, environmental factors, computer usage, contact lens wear, medications, underlying medical conditions like diabetes, thyroid, autoimmune diseases, and lifestyle. Now, in dry eye, many a times, your environment actually causes it. You just see your eyes, you just feel very uncomfortable with your eyes. You feel very uncomfortable with your eyes. And there's this feeling of grittiness. There's this feeling of grittiness, as if there's something in your eyes, something like sand, or sometimes people will feel like, oh, there's hair or something. It's just, it doesn't feel comfortable. Sometimes they will say, the eye feels dried. Some persons feel peppery sensation. Some will say sandy. They feel that if there is sand. And we call it dry eye. People will be like, but my eyes are always bringing out water. My eyes are bringing out water. What could be the problem? What could be the problem? Now, in dry eyes, we have glands that produce, in the eye, we have glands that produce water. We call it the lacrimal glands. We also have some other glands like the membranous glands, right? And there's a third one. I can't seem to place the name now. They work together to produce a very stable tear film. All right. So at times, the membranous gland, which is located at the lower lid, yes, is on the lid margin, all right, is located here. The membranous gland is located there. Sometimes the gland is being blocked because when you blink, there's an interface between just like the lacrimal gland produces its water, the membrane gland produces its oil to produce a stable tear component. All right. So sometimes these glands are blocked. When they are blocked, the eyes can be tearing, but it is not in the proper quality. That means they are not all together. They are not all functioning together to give a stable tear film. So your eyes can be tearing, but it is not, the tear is actually of poor quality. All right. So this happens during when someone has a dry eye syndrome. Okay. They also complain of blurred vision. Their eyes feels very tired. Then increased sensitivity to light. Now, for dry eye syndrome, the treatment includes use of ocular lubricants. Yes, I think those are over-the-counter drugs that way. And most times, the preservative-free ones work best. Those without preservative, they work best. Then a gentle hot compress, all right, to help release those glands that are being clogged up so that they can actually liquefy and be able to stabilize the tear film. Then the use of sunglasses in places where it's very hot, all right? Very hot or very dried, all right? Sometimes when you're going through a roller coaster, the wind, the wind tends to cause that dry eye. So you need to wear something to actually shield your eyes off it. Then there's this membrane gland expression. Sometimes when you go to the clinic, they'll have to express it. So that it's just like a pimple, trying to push it out so that the glands can actually work together to give a stable tear film. Then Ponta plugs. There are some plugs they had to use to cover this place so as to reduce the drainage of fluid or the tear. Then omega-3 rich foods, immunosuppressive drugs to reduce inflammation, or there are some therapies they use for dry eye. Okay. Next slide, please. Next slide. Okay. So the eyes doesn't feel comfortable at all in dry eye. Okay. So that's why we need to pay attention to every details. Now, computer usage, I guess I didn't put that in the slides. Usually when you're using your computer, you tend not to blink. You stare into it, just as I'm staring, just as I'm staring into it. You stare into it and you tend not to blink. And that blinking helps you a lot because you're lubricating your eyes. ACs, the positioning of ACs, I am presently treating someone on dry eye, and I was asking him, where is your AC located in your office? And he was like, it's directly opposite. I said, oh, it's going to make it worse. So you have to position your workstation so that you will not be directly affected by these things. Then the use of humidifiers actually help. Humidifiers can actually help in reducing the effects, as it makes it sends water into the atmosphere to reduce dryness. Okay, it reduces the effects of dry eye. Okay, so next slide, please. Age-related macular degeneration. As you heard, age, it has to do with aging. It's a condition that affects the macula. And the macula is the central portion, right? This is the central portion of the eye. That's the place with the greatest vision, all right? Greatest vision. If you notice here, okay, close to the optic nerve head is what we call the macula, okay? So it affects the macula and part of the retina. responsible for central vision, causing blind spots, distorted vision, and loss of central vision. This condition is usually common with the elderly. Usually genetics can also play a factor. Smoking, obesity, hypertension, they also play a factor. The symptom includes blind spots. They are looking at something in your book. You're reading something and they are seeing some parts is just black around. At times, they are looking at something in front of them. They are seeing a part. They are seeing a part. They are seeing a part, and the other part is not clear at all. Those are blind spots. Sometimes they'll be seeing their vision as if is distorted. Some will say it's looking wobbling. Then they also complain of colors fading. And the vision, when they are looking straight ahead, now they're looking straight ahead, the vision is blurry. But when you're looking through your sides, it's clear. So it's at your central vision that this macular degeneration happens. So treatment involves the use of supplements. They may have to give intravitreal injection, laser therapy, or low vision aids, okay, for such patients. Can we go to the next slide, please? Okay, that's fine. Diabetic retinopathy. Now, we all know what diabetes is: sustained or elevated high blood sugar in the body, all right? And it has its own effects. It has a whole lot of effects in the body. Aside the kidneys that has been affected, another part, the eyes are also affected. High blood sugar in the body can cause cataract. I've talked about that before. Can cause cataracts. And we are here with diabetic retinopathy. Now, diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina. Going back to this again, the blood vessels in the retina, those blood vessels that I talked about before. Can you see it? Those blood vessels, okay? Leading to damage. It damages it, and eventually the person loses vision. What's the cause of diabetic retinopathy? High blood sugar. And the duration of the diabetes, genetics, all right? And you know that diabetes runs in families, okay? So for these, there are different types. There are two types. We have the wet and we also have the dry one, okay? Now, the symptoms include blurred vision, floaters. You see some things floating in your vision. You just see some things walking, like just when you look at a bright, maybe you look at the sky, you see some things floating in your vision, or flashes of lights, or difficulties perceiving colors, and eventually vision loss. Usually you use a laser surgery because it comes with neurovascularization. That means creation of small, because when these blood vessels are damaged, the body itself did not start creating small, tiny blood vessels that can easily just bleed, because that's neovascularization. And those ones, they'll start leaking blood into the retina. So they'll use, the treatment is use of laser surgery to take care of those new blood vessels that are being formed, control of the blood sugar, vitrectomy, and intravitreal injection. In that case, the patient will, in fact, we don't wait till that time. The first thing is control the blood sugar. Now, we've seen some situation whereby a patient comes in and they'll be needing, person is like, I can't see clearly. And by the time you check the person's blood sugar, the sugar is very high. When the sugar is high, your vision is going to be blurred because a lot of water is being seeped into the lens of the eye, making the vision very blurry. Sometimes they'll be requesting that they need glasses. And usually we'll just tell you that no, you don't need glasses because we'll make any glasses for you now. You'll be changing it within a short while. When the blood sugar goes up, you'll be using a particular prescription. The next time when it comes down, you will not be able to use that prescription again. So we'll tell you, go bring down or control your blood sugar. By the time the blood sugar comes down, I will do a glass for the person, a pair of glasses for the person feels very okay. So sometimes when you have that blurry vision, just go check. It might be that your sugar is high. It might be, perhaps. So let's go to the next slide. This is how the healthy retina looks like. And look at the one with diabetic retinopathy. Now, if you notice, you see some little bleedings around. So little bleedings around the retina, all right? This is as a result of high blood sugar in the blood, okay? So it's now affecting the eyes. The lens, it also affects the lens. It affects, in fact, high blood sugar affects all parts of the body. And that's why we don't want to take it. We don't want to, we don't underestimate it. Please, if your sugar is high, please see your doctor and let them manage it to bring it down. There are always a different management plan to bring down your sugar. If diabetes runs in the family, please, you have to create a healthy lifestyle for yourself. Chart a path for yourself that works, that will be able to work well for you. And also speak with your doctor. Make sure you also explain to your doctor that there's a blood run, there's a family disposition to the diabetes. So let your doctor know. It can actually help you to chart a way to manage the symptoms, or if should it happen, or to prevent it. Okay, please can we go to the next slide? Hypertensive retinopathy. Hypertensive retinopathy is a condition where high blood pressure damages the blood vessels of the retina. Now, we're always talking about this retina, everything. This is what you are seeing on the picture. This is what you are seeing. So when I'm showing you, you also know that you have this in your eyes, okay? This part that you are seeing that is orange, that they call the optic disc, this is it here, okay? This is it here. So you understand. So when you are seeing it just flat like that, this is how it looks like. This is how it looks like. The plot you are seeing, the fovea, is the one I was showing you close by. Okay. The fovea houses, the macula houses the fovea. All right. That's the point of central vision. Okay. So uncontrolled high blood pressure is the cause of hypertensive retinopathy. Genetics, you know, and hypertension, they go hand in hand. When there's a history of hypertension in the family, the tendency for others to have it is very high. And other medical conditions can also cause hypertensive retinopathy. Even diabetes can cause hypertensive retinopathy. Yes. Now, symptoms include blurred vision, vision loss, flashes of light, floaters within the vision. Management is also control your blood sugar and blood pressure. Lifestyle modification to suit that hypertension. Laser surgeries for advanced cases. Anti-VEGF to because of the growth of new vessels, new blood vessels, and vitrectomy, just like diabetic retinopathy. Now, if you see this plate now, you see that there are some hemorrhages around. You see some spots, buttonhole spots, because of the generations that goes on. If you notice the silver wiring, that means those places you are seeing silver wiring, that means the vessels are gradually dying off. They are dying off. All right. So these are symptoms that we should be able to, when we have any symptom, you're not comfortable with your eye, you don't need to wait. You don't need to wait. You need to see an eye doctor. You should have one. You should have a regular eye check. From the age of 40, we start having different changes in our bodies. From the age of 40s, it's not, you don't feel that way the way you were when you were much younger. Different changes come into play from our eyes to our health in general. So I advise that everybody should have their eyes tested. You don't need to wait for somebody to tell or one symptom to go up for a very long time. You start, here in here in Nigeria, according to my mom, if you tell her, go check your BP, she'll tell you, it's not my portion. I reject it. And I tell her, it's not anybody's portion. Go and check it. Just go check it. Tell me your blood sugar. Let me know. I just want to know. Because we're not staying in the same place. So please just check it and let me know. I don't know if she'll be watching this. I just tell you that. Please, it doesn't take you anything. Prevention is better than cure. It's easier, it's cheaper to prevent. It's costlier to cure. All right. So in summary, your eyes are precious. So vision is essential for daily life, and neglecting eye care can lead to prolonged problems. Common eye problems can be prevented. Myopia, cataracts, glaucoma, and other conditions often develop slowly, but can be managed or avoided with early detection. Simple habits makes a big difference. Regular eye checkups, screen breaks, outdoor activities, and healthy diet are essential for maintaining good vision. Schedule an eye exam today. Practice healthy eye habits. And my last slide, please. Okay, no, the one before it. Your eyes are your window to the world. Take care of them today so you can see a brighter tomorrow. Thank you for your time. And if you have any questions, I'll be happy to answer them.
Oh my goodness. Thank you so much. I do have questions.
All right.
Like my at my previous events, it's we
Yes.
normally do it on Zoom, but this
Yes.
one, we're meant to do it last week, and last week
Yes.
moved it. So this has not been publicized like it should.
Okay.
So I thought, okay, let's just do it here, just us in-house, and then we
Okay.
share it on YouTube. And thank you to all those that are watching on YouTube. And we did start very shaky, but I
Yes.
so enjoyed your presentation. And I never knew that we had so much eye diseases. I
Of
wear
course.
glasses.
Okay.
I have been wearing glasses for probably the last maybe 25 years,
Wow.
if not more, if not
Yes.
more. That is
Okay.
because when I was younger, I remember when I was in primary school, I used to,
Yes.
I think in Nigeria, your seat is your seat. So I used to sit
Yes.
at the back for whatever
Okay.
reason. That was my seat. And I had a
Yes.
friend who I used to copy off her notes. So when they were
Okay.
writing on the board, I couldn't see
Yes.
it. because it
Okay.
was so far off, it was blurry for me. So
It's
I always
blurry.
chat with that my friend, and I copied
Yes.
of her. People would think I'm copying from her. Do you know what I
Yes.
mean? But I wasn't
Yes.
copying what she was right. I was copying because I couldn't see
You couldn't see
clearly what
exactly.
was on the board. So eye issue is something that I am passionate about as well. And having heard you speak now, I just have to tell you, I do have some questions. But I have to
Okay.
tell you that we will do this again, please. We started, you know how we started, we
Yes.
couldn't get you in, we couldn't get the audio, we couldn't get the video. Eventually, we got here, and I've so enjoyed the presentation. Before we go into doing this again, I do have
Yes.
some questions that I had to write down. So if you're watching on YouTube, you can just put your questions in quickly because we're far gone with time. And I'm sure Dr. Inye will quickly answer them. So my first question is, can one person have more than one eye condition? So you've mentioned a lot of conditions now. You've mentioned glaucoma, you've mentioned diabetic neuropathy, you've mentioned hypertensive neuropathy, and the other ones. Can one
Yes.
person, because I think
Yes.
I have a lot, because my eyesight is really
Of course. Of course. Yes. You can have more than one. Yes. It's possible
Hmm.
to have dry eye. It's possible to have myopia. Because myopia also leads to glaucoma. Yes.
Mm-hmm. Mm.
Yes. It's possible to have, in fact, there are different conditions. It's possible to have, but in terms of refractive errors, either you're having myopia, astigmatism. I did talk about astigmatism and hyperopia.
Hmm.
In terms of yes, there are different conditions. I just had to make sure the ones that are very common.
Yeah.
Okay, it's possible. Yes,
Yeah, but when you have all that conditions combined, how do you manage all of them? Say you've got myopia, um,
yes,
and then you've got glaucoma. So are they
yes.
the same treatment strategy, or do you have to treat them separately?
No, there are different treatment strategy. Now, in children, like children that has myopia,
Hmm.
we have a kind of therapy, myopia control. All
Hmm.
right, there's some kind of lenses that will give them because myopia has a whole lot of effects. It can cause retinal detachment that can eventually cause blindness on its own. Yes, high myopia. Yes, it can cause that. Then it goes with glaucoma also. If you notice that one of the risk factors of glaucoma is myopia, if you notice that in the
Yes.
slide, yes, it's one of the risk factors. It can cause that. So the therapies are actually different. The therapies are different. For myopia that is not progressive, myopia is not progressive, we can just give glasses and we can give glasses, contact lenses, or maybe go for a LASIK surgery. But LASIK surgery also has its own disadvantage. I think it causes dry eye. So there must be some they'll check out there'll be some parameters to check if you are compatible to do that LASIK surgery. All
Hmm.
right. So there are different therapies. So glaucoma, usually we use medications to bring down pressure.
Hmm.
So there are different therapies.
Okay, thank you. Thank you so much. So the next question is, um, you did mention the age-related one, is it presbyopia, phobia, something? How do
Okay,
you
yeah. Presbyopia.
the presbyopia? Yeah. So at
Yes.
what age can we begin to worry about that? Especially somebody like me that already has eye issues even from a younger age. So what age do we begin to worry about age-related issues as well?
Okay, now depending on the refractive error you have, from what you were saying, it look as though you are short-sighted. I don't know.
But I
Okay.
actually went to my optician last week,
Yes. Yes.
and I had to do an eye test.
Yes.
It was due for one anyway. This glass is
Yes.
blurry.
Yes.
I can see things that are close by. I
Yes.
struggle to see very far.
So that's the
However,
myopia. That's myopia.
However, the
Yes.
optician now said, for whatever reason, recently, and it's true, I've been struggling, even with my glasses, I've been struggling
Yes.
to see things that are very close. So when I need to look, I need to take my glasses off. So I can
Yes.
see something that's close to me. So for
Yes.
whatever reason, optician now said, okay, you need two
You got
glasses
to do a
now.
bifocal.
And yeah,
Mm-hmm.
He said I need two glasses. I need one when I'm driving or when I'm
Yes,
looking far, and then when I need to
yes.
use the computer, when I need to read my book, I need another one.
Another.
Thinking,
Yeah.
only me. Why do I have to have two glasses? Why too much problem like that?
Okay. From what I could tell, you're actually short-sighted. You've actually been short-sighted for a long while.
Mm,
Okay, so when you were young, okay, and if there was proper management, I don't think you'd have gone further.
mm,
I mean, if it was managed properly when you were younger, I don't think it could have gone far. Okay, so for you, as a person now, they can actually give you, okay, what you're experiencing now is that when you wear your glasses, because of the power of your lens,
mm,
the power of your lens is for you to be able to see far clearly, but not for you to be able to read. Because normally with a short-sighted person can see things closely without their glasses.
mm,
Okay, for
mm,
someone like you, they can actually give you a bifocal. And
mm.
maybe you don't not needing if you don't, I don't know, if you don't mind, a bifocal that has both your distance and your near together.
Get them. Yeah.
Yes,
Mm,
you need that's something like that. That's what you will need. So you're actually short-sighted.
mm.
So you're asking the age, from the
Yeah,
age
the
of
age.
40.
Yeah.
Yes, from the age of 40, you start experiencing presbyopia. But myopes, they don't experience it on time. Okay, they don't experience it as in that age because they already know that they can see without their glasses. So they tend not to like, no, I don't need anything for near. I can see things at near. It's only at far.
Mm.
So they tend to buy time to actually wear a reading glasses.
Yeah, I think
Mhm.
that's one of the issues I had then. I just didn't want
Yes,
to wear glasses. I was like, okay, if I can
yes,
and I can copy off somebody, I'm okay.
yes.
Till it got to that age where I thought I definitely need a glass now. So thank you so much. And the third question, I've got three more questions. I will be very quick with that. The third question is, you kept mentioning hypertension as a risk factor. Is it that hypertension is common with eye issues? Because I remember you said glaucoma is like increased pressure of the eye.
Yes.
So
Okay.
does that mean that chronic hypertension can cause glaucoma?
Okay. Yes. Yes, there's a relationship between there was a research that has between high blood pressure and intraocular pressure. There's a relationship between them. When the pressure is high,
Yeah.
it can also cause high intraocular pressure. So
Mm.
there's a link between them. So that's why whenever you have any condition, you have to manage it to the barest
Mm.
minimum, okay? So that it will not affect other things.
Yeah.
Yes, there's a relationship, yes.
I agree. Thank you so much. And the second to the last question, again, because you did mention that was it glaucoma now or the eyes is part of the brain. Say
An
somebody had
extension of the brain.
yeah, extension, yeah. Say somebody had glaucoma. Is that an indication of, I know this sounds silly, is that an indication of like a brain tumor? Is there any link
No,
between glaucoma and a
no.
brain tumor?
Glaucoma,
About the
it,
pressure. People come into hospital and they go, oh, I've got
yeah,
headache. Oh, I feel
yeah,
like this tight thing in my head. So I'm just trying to see if there's a link between that
okay,
recurrent headache, glaucoma, and brain tumor.
okay. Um, Brain tumor and this thing, no. Um, what I would liken glaucoma to,
Mm,
okay? In a layman's word, I assuming I liken this optic nerve, all right, to wires that connect the eye to the brain.
mm,
Wires that connect the eyes to the brain. All right. And if these are the wires that connect the eyes to the brain, in glaucoma, these wires they get cut off gradually. They cut off gradually. Now, the thing about glaucoma, it doesn't start from your central vision. It starts from your periphery, from your side vision. So the person may not even know that something is happening. until maybe by the time they do a visual fit test. All
Mm.
right. By the time they do a visual fit test, the test will not tell them that, oh, you can't see very clearly your periphery, you have some level of blind spot or around it, or you are missing some parts. Comparing you, because that's a visual fit test, compares you with your age mates. All right.
Mm.
Compares you how your age mates, what you are supposed to be seeing. So it compares you. So glaucoma deals with the optic nerve.
Yeah.
Now, when I said it's an extension of the brain, now through the eyes, through the eyes, there's this test we do. We can actually tell if there's a tumor
Mm.
from the eyes. All right, we
Mm.
can actually look into the eyes and look at the retina
Mm.
and tell if there's a tumor. The tumor will start pushing. It start pushing from the brain.
Mm.
And you know that this optic nerve is an extension of the brain. So it's going to push through from the optic nerve towards that side.
Mm.
So glaucoma destroys the optic nerve. Then the tumor pushes from the brain out. So there are two different entities, but I think they are on the same part, the same
Yeah.
optic nerve.
Yeah.
Okay.
Yeah. Thank you so much. Thank you. And the last question, you reside and you practice in Nigeria.
Yes.
I am here in the UK. So in terms of affordability and how people can access the services, they are quite different.
Yes.
I would like you to just tell people that are watching now and people that will come across this video in Nigeria, how easy is it to like assess an eye doctor? How affordable is it? Is this something that you can just go to your doctor to say, okay, because our system here, you can go to an optician and just register. They'll book you in. You can go, depending on your income, is either you pay or you don't. And for
Okay.
children, they don't pay. I know
Okay.
understand it's quite different in Nigeria. And people are using that yardstick not to get their eyes checked because of expense and all that. So can you throw more light on how can people assess you? Say I was in Nigeria and I wanted to see an eye doctor. What do I do? Can I
Oh,
afford it if I'm just that woman selling tomatoes in the markets? So just let us know. Thank you.
eye care is very affordable in Nigeria.
Yeah.
We have the government hospitals. The government hospitals, yes, it's at a very reduced rate. We also have the private ones. Um, I wouldn't say it's very it's affordable, but it is not as affordable. It's not as cheap as that of the government. Yes, government hospitals, but it's very much affordable. Very much affordable.
So
So
the
when you go to an eye clinic,
that's
when you
EA.
go to,
Sorry, my sister, to cut you short. So let's assume
okay.
that's EA. When I say EA, you know what I mean. That's mama,
Yes,
that's brother that sells
yes,
probably slippers in the market, somebody that's, struggling financially, maybe. Is that something they can afford? Say, let's use the public one now, the government
yes,
one.
yes.
Roughly, how much would it be? Can they go and say, okay, I've got 5,000 naira? Can you, I don't know, I'm just giving a rough estimate. But let's say with 10,000 naira, I go to a government clinic that I wanted my eyes checked. Is that possible?
Very, very possible.
Okay.
Very possible. Yes, for in our private practice, the basic fee you pay when you come in for now is about 10,000. That's the basic, and
Okay.
that includes your consultation tests
Yes.
and registration. Okay.
Okay.
Then any other thing will tell you if there are other things. Maybe from the findings, we can actually tell you that okay, this is what it is. This is what you're going to be paying. Okay. So it's very affordable. So
Okay.
it's when it gets to conditions that okay, you know that you have to get those things and it's quite expensive. So that's when you'll be
Because
talking about much more payments.
okay, thank you. That's very good to know because we need to give this information out. We need to tell people, oh, go check your eyes, go check your eyes. But you also need to tell them that this is where you need to go, this is how you need to go about it, this is how much you need to go with. So thank you so much. Before we close, just briefly tell us about your company. Your where you work. What's it called?
Need Specs Eye Clinic.
Nides. Yeah. I do follow you on Facebook. So just give us a brief. Just tell us about your place, where it is located. Are you in Lagos? Are you in Abuja? Where are you?
Okay. We are located in Delta State, in Warri
Okay.
precisely. All
Okay.
right, Need Specs Eye Clinic. We are committed to attending to your eye care needs in a personalized way. And we have qualified doctors. We have a team of experts that takes care of your eyes. And we want to give you the best. We are wired to give you the best. Your perfect vision is our top priority. So come in, we are open. You could actually book online. Yes, you could actually book online. We are there to take care of your eye care needs.
Thank you so much. So after this, if you want to send me, I'll copy your link anyway and put it on my Facebook page and probably
Okay.
put it in the comment section of this YouTube video as well. So in case people want to see you, in case people want to use your services, if they are in Delta states or if they want to travel down. But I just have to say thank you so much for your time. I honestly, I didn't know eye health was so interesting. I was like, oh, glaucoma. Okay, let's just see what's gonna happen. But I have totally enjoyed it. I have learned a lot, and I have to beg you that we're gonna do this again. And the two main
Yeah.
topics, to be honest, that I really want us to expand on. Thank you
Yes.
so much for touching on all the eye or majority of the common eye issues. But I would like us to do diabetic retinopathy. That is
Okay.
because a lot of people are diabetic.
Yes.
And a lot of people are working with undiagnosed diabetes.
Yes.
You think, oh, I haven't got diabetes. A lot of people have it, they just haven't been diagnosed. And imagine them
Yes.
having to complain about eye issues as well. So that's an interesting topic that I want us to talk about as soon as we have a date. The
Okay.
second one again is the hypertensive retinopathy.
Retinopathy. Okay,
A
that's fine.
million and one adults are working with hypertension. And I
Yes. That's
always say
okay.
in all my events, when you go back to my videos, I always say that one medical condition can spiral into 10 in the body.
That's true. That's
Just
true.
one hypertension, just one diabetes. Diabetes can cause hypertension.
Of
Hypertension
course.
can cause diabetes.
Of
Then they
course.
can damage the kidney. They can damage the
Yes.
eyes. It's like that. So
Mm-hmm.
I need to talk about hypertension and the diabetic retinopathy. So as soon as we have a date, I'm not sure when, probably next month, probably 2 months time when it's suitable for you and I, we will definitely organize more and then we'll do more publicity. And then
All right.
hopefully we wouldn't have issues with the internet as we had earlier. And we'll,
Uh,
we'll, we'll prep more. But again, it
yes.
was fantastic. Thank you so much for your time. And
Mm.
I'll see you when I see you. Thank you so
All
much.
right.
I'm gonna end now. Thank you to all watching on YouTube. Thank you to all that will come across this video. And I hope you have a good day. I'm gonna stop sharing on YouTube
Okay.
now just to